Health Partners is a leading health management company that's working to transform healthcare by improving the lives of patients as well as providers. With me is the Chief Financial Officer, Leif Peterson, just to bring me up to date on the company from the financial executive point of view. So I know you had your earnings recently. Give me the highlights, what's on track, what's still challenging, kind of what to summarize those.
Absolutely. Thanks for having me today. I appreciate being here. Yes, we just announced a month ago our Q1 earnings release, and we are showing some pretty positive trends in our markets. Overall, 3 of our 4 markets that we operate in are operating at or near break even. We have one market that is substantially operating negative right now, and we are in conversations with how to turn that market around with that payer partner.
What are the 4 markets that you're in?
The 4 markets we're in are Arizona, Nevada, California, and Oregon.
Okay. And which one's the laggard?
We don't publicly own that. Which one is laggard at this point?
Got it. Okay, but you're working on that. So what's the mission of the company? I get kind of a brief general, but what you're doing is really innovative in healthcare. So explain what P3 is doing.
Yeah, we are a physician engagement company. So we are providing the partnership between the physician and the patient. And we coordinate that care with the payer as the middleman. And what we are doing for providing tools to our physicians to enable them to have less time and energy spent on the administrative tasks of managing healthcare. And we do that through providing data and analytics on their patient populations. And so when you're at risk for a population, you want to bring that population into an office and you want to know what's happening with that patient holistically. What are all the core issues that they have at stake so you can manage their healthcare from a top-down perspective and coordinate that care across all the specialties that they might need. Okay. And so we coordinate information via claims, pharmacy systems, data exchanges, and we provide that in a concise package to those physicians so that when that patient comes in, they already have a heads up as to what's going on with that patient and how they need to address that patient, engage with that patient on a day-to-day basis. Ultimately, what we're trying to do is fulfill a quadruple aim, which is providing better care to our members, higher quality care, engagement with our physicians, and satisfaction with our physicians.
Okay. And maybe even drive down costs since everything seems streamlined.
100%. That's the whole mission. I thank you for bringing that up. Is when you look at a patient from a holistic perspective, the idea is to reduce the burden in the healthcare system and the waste. Mm-hmm. And if you can coordinate that care, you can then direct the care, reduce readmissions from a hospitalization perspective, and then reduce emergency room visits.
Okay.
Trying to be more proactive and preventive as opposed to kind of a historical perspective of reactive.
Which is I mean, kind of what, for some reason we can't get that done on a grand scale. Explain from the physician's point of view, how does a physician get involved and what is their process to become part of your network?
Yeah, it's a good question. So there's a couple different ways we can be involved. So we have contracts with payers. And if that payer has a contract if that provider has a contract with a payer, okay, then we engage with that contract as well. And they contract with our network. And our goal is to get deeper within the providers that we operate in. So we might have a provider in a market like Nevada, and we might have 50% of their Medicare Advantage population. We want to get deeper with that physician. The deeper we can get with that physician, the more lives we can manage, the more effective we can be. Because sometimes these providers are switching from fee-for-service to Medicare Advantage, and it's a difference from a holistic perspective on how you operate. The traditional fee-for-service model is really volume-based. It's very transactional. It's very much, what is the issue? Let's solve that specific issue and move on. Value-based care is, let's look at the entirety of what's happening in your life. What are all the issues you have? What are all the medications you're on? How are those things interacting and working together? And how can we better prevent downstream implications from those issues?
And for patients, so how do they get involved or find out more?
Usually they're aligned to their PCP.
Okay.
And so then that is one way. They also, from a Medicare Advantage perspective, on an annual basis, they sign up for a Medicare Advantage plan through a payer. And usually they're tied to their PCP.
Yeah. What about growth for the future for P3? What do you kind of get your eyes set on there?
So right now we are in a turnaround mode. 2025 for us was more of a year about contraction of our population base. So we exited 2024 at 124,000 lives. We are now at about 115,000 lives. And that was very purposeful in that contraction. And why we did that is we are going through about a $70 million turnaround plan from 2024 results to 2025. And that was made up of 3 different areas. Operational costs, efficiencies of about $20 million, contract and network rationalization of about $30 million, and then operational efficiencies across burden of illness and medics management. And why I say all that to answer your question is 2025 is a year where we really want to set the right foundation for solid fundamental growth in the business from a retained EBITDA perspective, so that then in 2026, 2027, we can be in a position to grow.
Okay. Okay. You're kind of building the base then for the growth of the next few years.
Yeah.
And just in general, healthcare, what trends are you seeing? What role is technology playing in how healthcare changes?
Yeah. I think it's a great question. I think it's an exciting time, quite honestly.
Yeah.
I just think about the innovation we've had holistically over the last 20 years. I mean, if you think about 2020, the iPhone was just getting introduced, 2022. And think about where we're at today. Everybody's got a handheld computer that they can walk around and access the internet. Same thing is happening in healthcare, but it's a little bit lagging. We're still fragmented from an information perspective. And so what's really exciting is the ability to start to pull in all that disparate information into a single source and provide that back out to our providers so that they don't have to navigate that landscape themselves, and we can provide that tool for them so then they can focus on providing care to their patient.
Absolutely. Like give the attention to the patients.
Right.
Piece of paper. So
exactly.
Yeah.
And AI is a big piece of that, right? That's going to be something that will continue to transform how physicians engage with their patients and how the next generation of patients actually engage with their physicians.
Yeah. Okay. Well, very interesting. Like, thank you so much.
Yeah. Thank you. I appreciate the time today.